The tripod grip, or the thumb ring finger grip of the needle holder, is identical to the tripod grip for the scissors. The tripod grip offers maximal control and accuracy. Position your thumb in the top ring and your ring finger into the bottom ring. Your index finger extends down the needle holders at or near the joint or box lock. The index finger provides control and accuracy during placement of sutures. A common mistake is to insert the thumb and ring finger too far into the rings. Your thumb and ring finger should not extend past the first interphalangeal joint. The palm grip is also called the thenar grip and is frequently used in surgery. The palm grip is best for situations where precision is not critical or more force is required. However, precision placement of the needle is best performed with the tripod grip. To perform the palm grip, hold the needle holders so that the top ring is positioned at the base of your thumb. The bottom ring is nestled at the base of your pinky and ring finger. The needle holders are opened by pushing inward on the lower ring with your ring finger and outward on the upper ring with the base of your thumb. The needle holders are closed by compressing the instrument between your thumb and the base of the pinky and ring fingers. It should be noted that a right-handed surgeon can only palm a right-handed instrument, and a left-handed surgeon can only palm a left-handed instrument. A left-handed surgeon cannot palm a right-handed instrument. The palm grip can be modified in a few ways. The first, which may be helpful for people with smaller hands, is to place your ring finger through the bottom loop. This will add a little more hand control to the instrument. Alternatively, the surgeon can only grab the shank of the instrument. This position is rarely used and allows for maximal power, but minimal control. The needle is held in the needle holders around 3/4 of the distance from the needle tip. This can be adjusted for very thick tissue, where you may hold it further back, or very hard tissue where you may hold it more forward to prevent the needle from bending. To correctly introduce a needle using needle holders, the needle should enter the tissue so that the cutting tip is introduced directly to the skin and the needle is oriented perpendicular or 90 degrees to the wound. The needle is passed through the tissue along the curve of the needle. This requires the surgeon to rotate the wrist and forearm as the needle passes with minimal lateral motion. The tissue is stabilized with tissue forceps during needle passage. The needle is then removed from the skin by grasping it with the needle holder and pulling the needle out, continuing to follow the curve of the needle with rotation of the wrist and forearm. Common mistakes are forcing a curved needle to take a linear path by not following the curve of the needle when placing in or removing from the tissues, removing the needle from the tissues with your fingers, and not exactly matching depth on both sides of the incision. The depth of the needle bite is very important. The depth of the bite on one side of the suture should exactly match the depth of the bite on the opposite side, so that when the tissues are pulled together, the tissue layers are exactly opposed. If the depth of one side does not match the depth of the other side, a stair step in the tissue is created, and healing is delayed. Finally, the needle should almost always be passed towards the surgeon. Backhanding the needle or directing the needle away from the surgeon is awkward and should be avoided. The needle can be removed from the tissue by grasping it with the needle holders. This is the most precise way, as it allows the surgeon to continue to rotate the needle along its curve. The needle can also be removed by grasping it with forceps. Should forceps be used, surgeons should not use forceps with a delicate gripping surface, like DeBakey forceps, as the delicate surface can be damaged by repeatedly grabbing the needle. Removal of the needle with forceps should only be performed if the needle is mostly out of the tissue. Once the needle is removed, the suture should be smoothly pulled through the tissue. To coil the suture, hold the needle between your thumb and index finger of your non-dominant hand and rotate your wrist to collect the suture in your hand. The surgeon should avoid moving one's arm out of the sterile field while pulling the suture through the tissue. Remember, a surgeon's hand should always be above the waist and below the shoulders.